Welcome back to the Pulse with Peter B. I'm your host, Peter Biancamano, and we are here for the third month in a row. I might have to start paying rent here, and that is at Hudson River Care and Counseling. And the person to my right needs absolutely no introduction because she was on the show 2 months ago, and of course you see her in all of our commercials as well, and that is the founder and CEO here at Hudson River Care and Counseling, by the way, located at 310 Cedar Lane in Teaneck, New Jersey, and 63A 8th Street in Hoboken.
That's a mouthful.
Exactly. And that is Dr. Pam Pater-Ennis. Dr. Pam, great to see you again.
Thank you, Peter. Thank you.
Absolutely. So, the last time you were on, Dr. Pam, we discussed basically an overview of what services you provide. Now we kind of want to zoom in to the specific services, and we're going to begin with trauma.
Okay.
So when you talk about the trauma services that Hudson River Care and Counseling provides, what are the types of things that you do provide?
Would it be helpful, Peter, if I just kind of explain what trauma is? Because I think it's become a really, almost an overused word. Trauma is really the result of horrific situations that have happened to people, whether it be sexual abuse, physical abuse, childhood sexual abuse, adult domestic violence. Well, domestic violence can happen in a household at any age, I guess. Even emotional abuse, which is harder to pin down, but it's certainly very real. And then there's a subset, I think, of religious or spiritual abuse, which I'm not going to touch on today. I think we're going to do that in a later segment to be aired maybe into the fall. But today I want to so trauma really is a very, if you will, normal human response to horrific circumstances. So what happens is that people, adults, women, children, can have different symptoms and things you probably hear about in the media. They may develop post-traumatic stress disorder, which would mean that they're having hypervigilance, nightmares, either insomnia or hypersomnia. They may develop comorbidities of eating disorders or self-harm, where they cut themselves or burn themselves, scratch themselves, all kinds of things like that. Or gosh, what else? Or they could develop more severe things like dissociative disorders, where people, like I always say, I'm spacey, so I can drive by like an exit on the turnpike and not even know I did it till a couple miles later. But that we all do that. But it's a continuum, and the more extreme forms of disassociation are really, like an extreme form would be like dissociative identity disorder, where what used to be called multiple personality disorder, and we do work with that here, where people really have been so traumatized as children, usually through severe sexual abuse, that they've developed different parts.
And Dr. Pam, I'm going to interrupt you 1 second because we spoke about this the last time you were on. We spoke about this with Yudi, who was on our last segment last month here, the pandemic. I'm sure we've seen these cases spike up. When you lock people in a house altogether, I'm sure domestic abuse, child abuse spikes up greatly. So
that's really good insight, and that's so true.
Right, exactly. So, obviously without going into any confidentiality here, was there a specific story or stories that you can explain, that where you've seen the trauma levels among families increase?
Absolutely. I think I might just add that, is anyone who already has a history of trauma, which most of the people we have layers and layers, and what we call complex PTSD. They might have been abused as a child, as an adult, maybe in different ways. So there's layers that we have to, it's almost like peeling back layers on an onion. You start on the outside, which might present, like I said, with anxiety or depression, and then you kind of move in towards the other stuff. But but I want to tell a short story. I have this woman whom I've probably been working with her a little more than a year now, and I won't, of course, mention her name, but she's a woman in her 50s who had horrific child sexual abuse by multiple members of her family, her father was alcoholic, but the one person in her family she felt loved by. Her mother was very dismissive of her and abusive of her physically and emotionally. And then she, not surprisingly, married an alcoholic and went through years of domestic violence and emotional abuse with him. And she then and again, not surprisingly, ended up having sexual harassment at her job, a very high-level job in New York City. And one day, she thought she wanted to jump off the subway platform. This was a couple of years ago in the spring, about 2 years ago now. And she literally had a breakdown. She just collapsed. She caught herself. Thankfully, she had enough ability to hold herself, but she knew right then. She got herself to the ER at a local hospital in the city. She lives here in Jersey. But that started her journey of healing. And then when she got out of the hospital, she came to me. And she's just a remarkable, wonderful, caring woman who is very artistic, has a lot of strengths, but we've worked through all kinds of issues, and we are still working on issues. We've worked through self-harm, where she hits herself in the head when she feels guilty. We've worked through helping her to separate from her husband. We've worked through her trauma of the death of her father, and also now dealing with an elderly mother whom she has to take care of, even though the mother abused her, which is a very tricky dynamic. So she's an amazing woman, and I always say to her in every session, you're moving from, you've now no longer a victim now, but now you're a survivor, and I want to get you over here to be a thriver. So you go from victim to survivor to thriver. Victim to survivor to thriver. And I always say to her at the end of every session, and I know you can't always take that in right now, but I'm going to hold out hope for you that you're going to heal.
Dr. Pam, that is unbelievable. I mean, and for the audience at home, and Yudi brought up a very, very good point last month when she was like, the first step is seeking help, making that decision.
And that's a huge step.
And the most important step. I mean, so for anybody watching at home, I think it's important that you let them know that you are here. Where could people find more information about you, the type of services you provide, especially the trauma services, because I feel that people are just, hesitant to ask for the type of help.
It's so scary because, I think the fear with trauma too is it's right. It's like having surgery. I always say you do worse for a while, but then eventually you heal because it opens all that up. But people can find us at www.hudsonrivercareandcounseling.com, and I am really full, but I'm not to say that to discourage you, but I hope you can see that we have a passion for the work we do. We want to help, and we're here for you. We now are in the middle of training some people to continue doing the trauma work. We really believe in it that strongly. And yes, all these events of the last few years, between the violence and even the Ukraine situation, now more racial violence recently, and of course the quarantine people are just on edge and need help on top of their own stuff.
Yeah, well, Dr. Pam, we really, really appreciate your time today. As you can see, she's very busy, but you made time for us. So, and for the
I'm honored that you had me.
Yeah, no, absolutely, no, we're honored to have you, and thank you so much for sharing that one story. I mean, it just must be so difficult for that specific person.
Oh, yes.
But it's also great that you have the people out there have a place to come, either to come see Dr. Pam or one of her many diverse staff members here at Hudson River Care and Counseling. Thank you again. Really appreciate it.
Thank you. I really appreciate you having me.
Absolutely. All right, folks, we will be right back.